Welcome to the University Hospital's Cleveland Medical Center Emergency Department. I'm Blake Nelson, and today I'll be showing you guys around RED. We'll start by taking an overview of our emergency department as a whole. As you can see, our emergency department is divided up into 3 different pods. We'll start our tour off today in Blue Pod. We are starting off in Blue Pod as this is where you will see your first patient as an emergency medicine doctor. Second years will also continue to work in this pod, and they will be the leaders in this area. In addition to leading the pod, our second years can expect to work closely with Case Western Reserve medical students and staff all patients that are seen by them. In addition, you'll be responsible for responding to criticals and traumas throughout the entire emergency department. Our next stop, just on the other side of the wall from Blue Pod, is our pediatric emergency department. This is an academic tertiary care pediatric emergency department that is staffed 24/7 by pediatric EM trained faculty. Early in your intern year, you will have a 2-week dedicated block in this emergency department, and then afterwards, you can expect to work about 1 to 3 shifts in the pediatric ED throughout your entire residency per month. In addition, this is the only pediatric level 1 trauma center in the region. As a result, you can expect to be an active team member in all of the trauma activations on the pediatric side. Our next stop is Gold Pod, which is our low to moderate acuity pod. In this pod, we have our Super Track, which will allow you to get experience with quick decision making and disposition for some of the less urgent complaints. Additionally, in Gold Pod, you will be the sole provider overnight, which lets you grow in autonomy and also simulates the solo coverage emergency medicine experience. Our tour will now lead us to our trauma bay. As a level 1 trauma center, we see a high volume of both blunt and penetrating trauma. As a second year, you can expect to respond to every single trauma and be responsible for all procedures that are done on the right side of the bed. As a third year, you can expect to be at the head of the bed and be responsible for airway management, including intubations in all of our trauma patients. You will additionally rotate with the trauma team during your intern year, so that's a good time to get those procedures on the left side of the bed. Where resuscitation happens in every pod throughout the emergency department, our sickest patients first go to room 3. Room 3 is equipped to handle any medical emergency you can think of. From ECPR to airway emergencies, it all happens in this room. As a second year, you can expect to be the proceduralist. Every airway, every line, every other procedure is your responsibility in this room. As a third year, you are responsible for running the room. You will lead your team, call out all critical medications, and make decisions in order to best serve your patient. Lastly on our tour is Green Pod. Green Pod is where you work as a third year resident. Here, you are constantly challenged by traumas, critical patients, as well as the highest acuity throughout our entire emergency department. If you can master Green Pod as a third year resident, you will be ready for anything. Of course, we can't end our tour without showing you our resident lounge. In our resident lounge, you can hang out with your co-residents before shifts, grab a quick coffee, store your food, and maybe even wrap up some notes after a long shift. Thanks so much for joining me on this quick tour of our emergency department. If you'd like to see our emergency department in person, please feel free to reach out to any of our residents or faculty members. We'd be more than happy to give you a tour of our department in person at any point throughout this entire interview season. Hope you guys enjoyed. Have a great rest of your day.